My name is Mary Thomas, and I'm practicing in Baton Rouge in family practice, and I have been practicing here in this town for the last 20 years. There are several reasons for me to select my job as a physician. My husband is a pediatrician, and all along I have been wanting to be a doctor, but with a family, husband, with children, it is very difficult to go back to school and all that. That's what I have been thinking in the past. But my husband was the one who encouraged me to pursue my interest in medicine, and he supported me all throughout. I started my medical school when our kids were in high school. But I did it. I'm so happy that I did it. I'm creating a lot of great impact on other people's life. And it is a lifetime commitment. It's not like one day or other. You are establishing a relationship with patient, and they learn to trust me, and it is a mutual relationship. So through that relationship, they are willing to do what is necessary for themselves, knowing the fact that they can trust me with what I tell them. I have been wanting to become a doctor from middle school on. Of course, going to the local doctor I'm originally from India, going to the local doctor, all this, the atmosphere at the hospital attracted me, nurses just taking care of the patients, and I really like that kind of setup. But my grandmother was at the time, she was a very orthodox lady. She died about maybe 20-30 years ago now. She said, no, ladies do not become doctors. Okay, that's for men. So, and after that, I haven't thought about it. I said, okay, maybe that's, at my age, that's what I thought. And then later, after getting married, my husband was a physician. So seeing what he has been doing made me to pursue further into what I really want to do. Just like I said in the past, because of our children, I thought it is impossible. The medical school is about 70 miles from where I am, from Baton Rouge. And how is it possible with 3 children? But he encouraged me because there is no time for me to wait more, because I'm older, and I need to do what I have to do right then and there. The medicine right now is quite different. When I compare with the medicine that I started to practice about 20 years ago, there are very many complex changes that have happened. Now, as a result, doctors are needing to spend more time on paperwork rather than face-to-face interaction with the patient. Okay. Now, the healthcare business wants to improve the quality of care, but they are emphasizing more on paperwork, less time on interacting with the patient, rather than understanding what is going on with them, knowing the patient, or maybe establishing a relationship with them. They are focusing more on what can be put on the paper so everything looks well and good. But in actuality, not necessarily it is happening. In order to bring the income to sustain my expenses, I had to see a lot more patient, but the pay from the insurance company, the fee for service pay, is a lot less. So as a result, patients are seen in a hurry, and many times many physicians miss many of the things that could have been identified. And when problem comes, it is diagnosed later at a stage. At that time, it may be a little too late to reverse the situation. My main reason that I wanted to be independent, because I like the relationship with the patients. I like to talk with people. I like to know them. I would like to their likes and dislikes, maybe their goals, maybe their successes, or maybe their failures. That way you are establishing a deeper, meaningful relationship. The fact is, insurances are willing to pay for the high paying procedures for the specialists, but they are not willing to pay the preventive care for a primary care doctor, but they don't realize, the preventive health care, for example, obesity management, chronic condition management such as diabetes, hypertension, arthritis, stroke, you name it. All of them take time. It is not like walking into a room and give them medicine and just walk out. Okay, you are going to be fine. That doesn't happen that way. You have to impact on the life of the patient. They have to realize, why am I doing this change? What am I doing something wrong? What are the things that I'm doing wrong? And then as a result, that could be the cause for my, the chronic medical conditions or whatever that they are going through. Once they realize, they are willing to make the changes. That method of practicing medicine is more effective in the long term, and also it is cost effective, rather than for a patient to have all kinds of medical problems and going to a doctor and get very expensive diagnostic studies and all that, and still they cannot go back to where they were before they developed all these problems. During the last 2-3 years, I have been doing a combined program with limited concierge service. Now, I have learned a lot from my experiences with my concierge patients. There were several instances, but from the in-depth physical exam, we have found so many serious medical conditions that could have been majorly detrimental for the person. In concierge practice, you are spending a lot more time with your patient, and that helps me to identify many of the problems or many of the issues that have not been addressed in the past. So there are several instances where I have diagnosed major issues for which many of them were very thankful to me. Okay, for example, 3 weeks ago I had a patient who came for their in-depth physical exam. She's in her late 60s, healthy woman, mild hypertension, little cholesterol, and she has been doing well. When we did the EKG, there were noted to have some minute changes, and she is feeling well. She does not have any problems. She says, "Oh, I don't have any chest pain, no shortness of breath, no, nothing." And I told her, "Okay, anyhow, let's consult a cardiologist." And so I went to the cardiologist. They did the diagnostic studies, and she was told she needs a catheterization. When they did the cardiac cath, she had major blockages on 2 arteries. And on the same day when she was diagnosed with those blockage, she called me from the cardiologist's office. "Thank you for letting me know." And then, day before yesterday, she had the surgery, and her husband called me and said, "I'm so thankful that we found our surgery went well. She is in the ICU. She'll be most probably out by today. And I wanted to go and see her and just, see what's going on." One of my male patients, he is also close to 70. And, during our physical, he was noted to have a little dark spot on his right lower leg, on the side. And I asked him how long he had been having it. And he said, "Yeah, it has been there." And the doctors looked at it and they said, "It's nothing to worry about." And I said, "No, it doesn't look right. So let's do a dermatology consult." And then when they did the biopsy, it turned out to be melanoma. They did the dissection first, and they had to go in more deeply and just do extensive surgery to, to keep it under control. He's doing well now. If we did not address that problem right then and there. Melanoma, it's a major serious illness. Once it spreads into your other organs in your body, it's too late. Of course, you can go through the chemo treatment and all kinds of other treatment, but it is not the same when you diagnose the situation early enough so the complications won't be happening later in life. I think the most important fact about concierge practice is, each person is getting an exceptional standard of care. We pay closer attention and identify the problems that need to be addressed rather than running a lot of unwanted tests. We focus on the problem. Many times you are able to explain in detail to the patient. Sometimes when patient comes, I pull up my computer and I just show them the pictures and explain things in such a way that they understand what this is all about. That makes a world of difference. Of course, all physicians are human. They may not know all the answers right then and there, but at least in my case, I can spend the time and explain things rather than rushing to the next patient without addressing the problem the patient had. And that's very important for the patient. The patients are the ones who are benefiting from it. And also, for a physician like me, it gives me a great inner satisfaction. It's the most rewarding feeling or satisfaction. I know that this is an investment in your health, and I hope you join this practice.